You've got this thing on your back, so just for orientation for everybody that's watching, this would be the shoulder blades in the back, right? This is the back of the head, and so kind of between the shoulder blades, but below the neck here, you've got, well, you can see for yourself, you've got a large cyst, right?
Yeah.
And kind of tell us the story a little on this.
Well, it's been a pretty good sized bump under my skin with no coloration for a few years.
Yeah.
No discomfort, no leakage or anything. And up until a couple of weeks ago, it started turning red, feeling pressure, warm to the touch, and without any help, it just kind of started to leak, and then it just kind of progressed from there.
And you took a trip.
Yes, we were over in Israel, in the Holy Land.
Now, how long have you been back from that trip?
A week.
A week.
Yeah.
And Mrs. Speedy did some work on this for you, right?
Yes,
Okay.
she was extracting some.
She squeezed a little out, and then you started doing some warm compresses and that kind of thing. Okay.
Yes.
Has it been hurting a lot?
No, just to the touch.
Just to the touch. Okay.
If I laid flat on it, yeah, putting pressure on it, it would be sensitive, but it's bearable.
Okay. So everybody can see what you have here is an epidermoid cyst, and it it's rather large. That's about 2.5 to 3 inches by 2 inches. Clearly fluctuant. It's open here. It's freely draining. It's inflamed. The question is whether it's infected or not. I tend to lean toward probably not infected, but definitely inflamed. The fluid leaking out of here is a lot of proteinaceous material. You've actually got some broken down fat material in here, and keratin, proteinaceous. So we're going to numb this up a little bit and see if we can't empty this for you. Okay.
Okay.
We like to, when we know there's a cyst, we like to try to remove the sac and all of that, but this is one of these things that happens at the primary care level. People come in like this, and doctors often say, well, I don't even know what to do. Where do you start with this, right? Because it's really almost overwhelming to think about the whole process. So what we're going to do is we're going to provide some local anesthesia. We're going to numb this up. We're going to empty it out. I'm going to use a curette. We're going to try to scrape as much as we can and see if we can get as much sac material out of there as possible. But the idea that we'd be able to, clear this all out at the same time as removing the sac is probably not going to happen. Okay. But what we can do is we can certainly improve the condition quite a bit, get rid of the pain, get rid of all of this extra material, and we can allow some healing to occur. And then down the road, we can plan a time where we can come back and maybe we can remove the sac at that point, okay?
Okay.
But right now, we don't want to get into the skin any more than we absolutely have to, okay? Because the risk of infection is too high. Right. So Gummy Gene's going to spray a little cold spray, and I'm going to numb this up with a little lidocaine with epinephrine. You're going to feel a little stick, sting, and a burn. And my objective now is to not inject fluid to the point where this erupts all over the place. Gummy Gene, you froze my needle. That's okay. It's working now. So the medicine's going in slowly. That sting much? A little bit?
A little bit.
A little bit. So we're going to do another needle after this one, okay?
Okay.
All right, so we're going to go shallow first, and then we'll go deeper. So we know that there's an underside to this, right? There's a bottom,
right.
And underneath that is going to be some, myofascial kind of material, muscular tissue, along with some connective tissue, right? Mm-hmm. And so when we start scraping down there, that's going to hurt if we don't get an anesthetic in you. All right, now we're going to go a little bit deeper. That just really looks painful, doesn't it, Gummy Gene? Mm-hmm. Hope it's not hurting as much now, Speedy.
Well, it's been angry.
Speedy told me he's not quite as speedy as he used to be.
Oh, well.
With age, we slow a little bit. Now we're going to try to go underneath, and this might sting. In fact, it will. This should hurt. If I get down, I want to get below. I don't want to get into the cyst. There we go. And in this direction. Now, if at any point while we're doing anything, if you start to hurt, you just tell me, okay?
Okay.
I'll use a little bit more medicine. You said you had watched some of our videos, so we don't like people to hurt, right?
Yes, right.
Okay. So in the future, don't wait till it looks like this to come in, okay? That's a lot easier. You feeling it?
I'm anticipating it, but I'm not.
You're not feeling any pain? That's good. That's what I want. I don't want you to hurt.
Done that enough.
All right. Thank you, Gummy Jean. So we can see where this has already got a good size. That's about a dime-sized opening that already exists. So now I'm basically just going to start by just expressing what you have here. I'm going to get a feel for kind of how deep this goes. You can see there's quite a bit in there, Gummy Jean, so keep your distance. Okay.
In doing that, have you ever had the sac come out?
All the time.
Mm.
We did the other day, right, Gummy Jean?
That's the best case scenario?
Well, that would be awesome, right? Where the sac just sort of pops out too and it all just comes out. Yep. All right.
Are you gonna, or no?
Yeah, let's do a little culture. Does that hurt at all? Let's see if we can't get a culture. Again, I'm not convinced that you have an infection, but better safe than sorry, right?
Right.
See, I feel around the edges there you've got, definitely have more in there. All right. Let me go ahead and let's get a scalpel. Okay. Well, it looks a lot better already, I'll tell you that.
Yeah.
I'm going to open this up just a little bit more right here. Skin is very thick right there. And then right there. So if you're, for students and so forth that are find themselves in this situation, you want to do your best to empty the sac or empty the cyst as much as possible. You want to make the patient comfortable. You want to get them on some antibiotics, and you want to do your best to clean it out as much as possible. Get as much of the oily, proteinaceous material out of this that you possibly can. If you're able to, get a curette and get in there and start scraping. You hear that scraping noise? Did you feel a little pain? Okay, let's get a little more anesthesia on board. Now that we've got a lot of the material out of the way, we still see some more in there, but we can do a little better job of using the anesthetic here.
Probably a longer needle, huh?
Yep. Well, you don't really need a longer needle. We have better access to, and this is all very thickened skin around here. We call that peau d'orange. That's just basically inflamed skin that'll return to normal over time.
You need more than this?
Yes. Yeah. So we're gonna get a little bit more medicine for you. Oh, good, you brought it in here. Thank you. All right. So a little more anesthesia now. Here we go. But just so everybody can get an idea how deep this really goes and how big it is, you can actually get way up in there. So,
Wow.
okay, that goes way under there. That's how deep this is channeled. So the idea that you would just suture this up somehow and he'd be fine is absolutely inappropriate, because you've got this space in there. We call that a dead space, where you just have material and blood, and it's going to all just kind of congeal in there. And what'll end up happening is it'll get infected, even if it's not infected now, which we think it may not be. But so we just keep kind of working here from the edges, make sure that any oily material we can get out, we're going to get out now. Surprised you how deep that was, didn't it?
Yeah.
You okay, buddy?
Yeah, I'm fine.
Okay.
just trying to relax, so I know what makes it easier for you.
No, you're fine. You're in a good position right there. Joey Jean, we're going to have to pack this the best that we can.
I used to come here all the time.
We're going to need a lot of packing material. So you got little pieces of what could be sack that I'm seeing in here. So I'm just kind of poking or pulling these out a little bit at a time. Okay?
Okay.
Nice and easy. You know what would be good, Gumby Jeans, if I got one of those large cotton tip applicators?
A large one?
Well, or a
Or
couple of
these?
those that you have over there are fine. You'd be amazed at how deep this goes.
Really?
Yeah. I like to use a little dilute peroxide to flush so that it helps bubble out anything that's done. Oh, it felt warm?
Mm-hmm.
Good. All right, let's pack it. What are you doing tomorrow?
Me?
Yes, sir.
We're celebrating the first Astros win.
Okay.
Woo-woo. Go
You can
Astros!
come in and celebrate with us because we're going to have to remove this and replace it tomorrow.
Okay.
Game's at 7:08, right?
Oh, I don't
Isn't
know.
that weird? 7:08?
I know.
Well, they do that on purpose. Right? You're more likely to remember 7:08 than 7 o'clock.
Yeah.
They have a team of psychologists that help them decide when to start games.
Yeah, really.
So we're packing this open so that it won't form collections of fluid in here. Okay, so it won't
Okay.
locculate. All right. Okay, that should do it. Let me feel it here. Yeah, good. Gummy Jean, you're going to dress this for
Yes.
us? Oh, we had a little left over. Sure you discard that for me? All right, so when you shower, you're going to have a little plastic dressing over this tonight, okay?
Okay.
So just try to leave it alone. This is going to bleed. This is going to ooze. Expect that, okay? If the dressing fills up and you've got to replace it, that's perfectly okay. Just leave this tape in here, all right?
Okay,
Don't pull that tape out.
But try to keep it as dry as possible.
Try to keep it dry if you can. You can still shower, just don't scrub on the dressing or anything.
Right.
You want to take it from there?
Yes.
All right. Oops, stay real still for me. Stay real still.
Okay.
There we go.
Fall asleep.
All right. So I'm going to need you to come back tomorrow. We'll remove the packing and we'll repack that for you, okay?
Okay.
Speedy, we appreciate you letting us video this
You
for
bet.
our fans on, well, YouTube and Facebook and all over the place. And we will see you tomorrow for an update, okay?
Very good. Thank you.
All right, folks, this is Emily, and Emily's been using Cocoa Skin Plus. Emily, you want to give your personal testimonial?
I started taking Cocoa Skin Plus about 6 months ago, and since then I've noticed a huge difference in my skin. It's softer, my hair is softer, and it's grown so long.
Awesome.
I highly recommend it. I've definitely noticed a difference. It's definitely helped my hair feel better, my skin feel better, and you can pick it up on Amazon.
All right, check out Cocoa Skin Plus on m7amazon.com. Available, and it was designed by Dr. John Gilmore. Thanks.
Tell us something.
Hi, I'm Suzanne, and I take Dr. G's Meta 7.
This right here?
I've been taking it since, well, for 1 month, actually.
Okay. And
And I really enjoy it because it activates my life, just like it says. I have lots of energy.
you do have more energy.
And yes, a lot
And
more
you're
energy.
taking it as part of a weight loss program, right?
Yes.
Okay, and now we have lost some weight, but we're not going to attribute all of that to the Meta 7 because we use something else to help. But the good thing is while you're losing weight, you still have lots of
Energy.
yeah. Thanks.
You're welcome. And I like to swim, and so it's great because I can swim extra long because of the Meta 7. I really, really enjoy it.
Awesome.
So, yes,
Thanks.
you're welcome.